Good afternoon and welcome to another edition of This Week in Digital Health. We are pleased to be joined today with João Bocas, and I know I mispronounced that, so he'll fix that for us. He is the CEO of Digital Solutum. João, how are you today?
I'm doing well. Nice to see you again, Mike.
Nice to see you. So how do we pronounce your name since I'm apparently going to kill it?
João.
Okay, so not a chance. That's good. I'm going to get that right.
You've done well. You've done well.
So you're a social influencer. You have a pretty big following on LinkedIn. You're working on digital health projects. Tell us a little bit about your background and what your focus is.
Yeah, sure. I actually come from a professional sporting background. I always say I have two passions, sport and health. I've been in healthcare for over 25 years. I've worked in corporate wellness, in the wellness industry, but the last 15 years I've been in healthcare. And the last 7 years I've been heavily involved in digital health innovation, also in wearables. ACA, the wearables expert as a brand. But Mike, the last 7 years I've been heavily involved in digital health. So following the industry trends, also playing a role as an influencer, sharing content and steering conversations in pushing these important agendas forward.
And you have a podcast, right?
Yeah, also I have a YouTube channel called the Digital Health and Wearable Series.
Okay, so we will put a link to that below so folks can find you. So your bio says that healthcare is broken. What does that mean?
Well, healthcare is extremely fragmented in global markets around the world, also in the United States. And one of the issues that healthcare has, apart from the access and the expense and the complexity of the industry, because healthcare is very different than other industries. The other industries present some challenges, but healthcare really goes beyond anything that you can experience. Also, healthcare is traditional, many more stakeholders and important dynamics. So healthcare is more prone to fragmentation, complexity, and also much harder to solve problems on a global scale, on a big scale, because things in terms of making changes and adapting, it takes a long time because there's more people involved. Also is the health systems that have traditional structures. So there are many nuances and things to consider here.
Yeah, I mean, a couple of years ago, the magic phrase was digital transformation, right? Everybody was like, oh, and then after sort of talking about that for a couple of years, people realized that's incredibly hard when it comes to healthcare, right? Because, like you said, everyone's operating on older legacy systems that were very expensive to produce, so they're not so quick to abandon them. The few efforts that we've seen in any substantial digital transformation have not been terribly successful. So how do we move past this, this blockage where, we need to move to a digital system. We need to be able to share data when and where it's needed. And yet we don't have the systems in place and it doesn't look like it's going to be anytime soon before we get there.
Yeah, Mike. So as I mentioned, healthcare is extremely peculiar, very different than the other industries. Also, we have this traditional structures and the systems, outdated processes. Even in here, I operate globally, as you know. I follow very closely the United States of American market, but I'm based in UK, but I travel internationally. Even in UK, for example, we have the national health system, great service, by the way. I don't want to criticize. It's free, it's accessible, you can get the clinician, you can access a doctor. But even here, in different parts of the country, they use different providers. So, for example, if you are in Northeast, in Manchester, you might not access your health record in London. If you break a leg or an arm in a different part of the country, they don't know who you are. Because the way healthcare is structured, they buy long-term deals with different providers, different IT systems, different providers. So bringing everything together is extremely difficult. Also, we also think it's about technology, and it is about technology to a certain degree. But to revolutionize all these things, we need to buy in from the top leadership, but start from the bottom. And that's a very that's a different type of dynamic, because you want the buy-in leadership from the top management, but you need to start, for example, with the nurses or even the assistant people on the ground. They receive the patients, they are in day-to-day contact with the patients, and that's very difficult to achieve because is a misalignment, and it's actually you are at the opposite side of the scale. A managing director trying to figure out what is better for the organization in terms of effectiveness, but the reality on the ground is actually completely different. And what is very often missing is this gap, what needs to be done, because the perception of the top management is very different than the day-to-day base of a clinician. The clinician needs technology, but they also need a different type of process, approach. They need a different type of change. So going back to the change management, many organizations fail very drastically because they start from changing the technology, changing the way they do things without consider all this fragmentation. And there is a lot to consider. So there are companies, as you know, Mike, just specializing in bringing everything together, creating the strategy for successful digital transformation. It is very important to understand how it works and what you're trying to achieve.
But I mean, the successful digital transformation, is that a concept, or are we actually seeing real examples where companies have successfully migrated from a primarily paper-based system to a digital system? Do we have, success stories when it comes to digital transformation?
We have success stories on the ground, really. And in here in UK, I go back to UK, the NHS, the National Health System, created an organization to do innovation, the NHS X. We have an app, for example, with the COVID patients. We have one system, but it's very difficult, and it's been a long drawn to get to this stage. And even now, the system is not bringing everything together countrywide. I follow the examples of countries in the Nordics. They have a very proactive approach in planning ahead. We see the digital country of the world, for example, Estonia, not just in terms of electronic medical records. It's a bit easier with 6 million inhabitants than with 300 million and 50 states. In the United States is a completely different reality. But these countries, actually, they have one thing that they've done very well. They plan ahead. They're saying by 2025, for example, we want to do this. And so it's not a kind of ad hoc digital transformation as we go along. And that's one of the things that I see very often that doesn't work. Fixing as we go along. We need a plan. We need the implementation plan. We need to follow. We can't do everything yesterday, and we certainly can't do everything today. So having a bit of a roadmap really, really helps.
Yeah, I mean, we had a guest recently who suggested that, we should stop trying to fix the old technologies because we can't, and just have to really just build from the ground up and start from there. What's your response to that?
Actually, that's a very good point, because if you build from the scratch, it's probably more time consuming, and it's probably more costly, but also you will personalize, adapting to the existing needs, not the needs of the 10 years ago health market, and not pushing ahead, trying to do something that perhaps will work or will not work, trying to take the guesswork out of the way. So building, one word that is very often used now is co-creation. And I go again back to the Nordic countries. I personally have a friend in Denmark that is very successful at doing co-creation within the pharma market. They have a speciality of bringing every stakeholder. They do these workshops. They bring a solution from scratch, from hearing all the needs from the patient, from digital experts, from UI experts, and bringing everything together. And I think building from scratch is always a very good possibility, and it gives you a certain guarantee that perhaps you're gonna build something that will go according to your needs, and that's a very good start.
And you know, are these bigger organizations, are they actually able to build something, or is this really a case of, you know, we let the startups build it, and then when it's far enough along, we, you know, that we do an M&A strategy?
Very good question, Mike. I see very often the big organizations trying to stay out of the way of building actually products, and to start with, they might not always have technical expertise in house, but also what I also see is a very they're very defensive around startups too. So they're very pragmatic. So it's a bit of a conundrum. They want to advance in terms of progressing fast with innovation, but they're trying to be defensive and anti-innovation, if you like, by working with startups. And at the same time, they don't want to build anything in-house. So they end up most of the time not taking a risk immediately. It's taking many, many years to take action, which doesn't really make sense, but that's the way, the nature of big organizations.
Yeah, I mean, one of the things that we've seen time and time again is, you know, when you talk about timelines and you talk about, like, you know, soon, that definition is quite different for a large organization and, you know, and a startup. We were at a panel, and you know, we asked a question about, you know, like, what about the immediacy? And there was an insurance company on the panel, and their immediate sort of near future is 10 years. Where I think there was a big healthcare provider, they were talking maybe 5 years. And then we turned to the startup, and the guy is like, yeah, I'm like at best 6 months out. Right. So, you know, when you talk about urgency, you have to consider who you're talking about, because urgency in a big organization, it could be 10 years.
Very good point, Mike. Yeah, and I've done a lot of consulting. I mentioned this intelligence from the Nordic Europe, but from the Nordic markets, because I've done a lot of health tech consulting with startups and scale-ups from the Nordic markets, Finland, Norway, Denmark, very innovative countries, to bring them to UK and other parts of Europe. And you are very right, there is a very good point. For a small organization, immediate is 3 months, 6 months. For a large organization, it might be 5 years. And we're talking about the insurers, and I experienced that on the ground, meeting high senior level C-suite executives in management of large insurers in here in UK, and they were in a position to take action 4, 5, 6 years ago, and for some reason they didn't. Only now they're starting to consider these conversations that they were having 5, 6 years ago. So you are very right there.
Yeah, I mean, you know, there's a question of risk tolerance, and, you know, their idea of urgency, right, is just completely different than what, you know, most of the folks on the ground are looking at. So, I know that you're a big fan of wearables, but we have some other emerging technologies. Let's sort of turn to 2023 and what we see on the horizon. Let's start with wearables. Where do you think wearables are going to be?
Yeah, wearables, as I see, Mike, they are a crucial element of the healthcare delivery of the future. And one thing that we talk a lot is about preventative care and about risk management and about disease management. Wearables can bring a lot of value by acquiring data, transferring data, and enabling patients to diagnose early, management of long-term conditions, and that prevention piece, especially with health wearables, not just the medical devices. But there are two main streams, the, let's say, health fitness wearables, and then there are the medical devices. I see now a big adoption in the medical device side. Organizations trying now to bring data in and bringing that into the existing health systems, into the existing data acquiring platforms. I think it will take a few years for us to see the maturity in the marketplace, but I see really the adoption increasing quite a lot in the last perhaps 12 months or even 24 months. So I see wearables as a crucial piece of the healthcare delivery of the future.
Yeah, I mean, one of the interesting things is we're seeing the greater adoption of wearables as well. What we're not seeing, or what seems to be a challenge, is what do we do with all this data, right? Because we prior to the wearables, we were doing point in time, so we'd collect a data point once a day or something like that. Now we have this constant stream of data as a result of the wearable, which obviously gives us more insights. But more data means more, data management. So what do we do with all this data?
Yeah, very good point, Mike. I mean, when I'm an advocate of wearables. I love wearables. My working desk at home is full of wearables. But one thing that the wearables also bring, they bring another layer of complexity with an already very complex system. They bring more data, they bring a bit more headache, they bring the interoperability issue, they bring the security issue, they bring the hacking issue, the cybersecurity. So they bring all these things along the way. And to be honest, I'm not a clinician, but we all know the clinicians, they don't have time to scrutinize data, to go over the data, to help patients and say, okay, half an hour I have extra, I analyze your data, I make recommendations. We've been hearing for a long time about wearables bringing meaningful insights and the data be transformed into information, but that's not always the reality. And sometimes we have a lot of qualitative and even quantitative data that is kind of meaningless because we're not using it. So, I mean, too much data is actually counterproductive.
And then what other things are we seeing on the horizon? What is your take on, predictive analytics and what we're using machine learning and AI to better understand the insights for leading for earlier detection?
Yeah, I mean, artificial intelligence now, machine learning and other augmented capabilities are very developed. I see a lot of potential. Some healthcare providers have apps now and technology that actually have kind of a scrutinizing way by asking a few questions and do triage using these capabilities. So it works, is evolving very, very fast, and also performing a lot of tasks that enable clinicians to have more time, perhaps repetitive tasks, or even like some less important things that can be replaced. I always go back to this question. I don't know who shared this first, but artificial intelligence will not replace the clinicians, but will replace clinicians that they're not using artificial intelligence. So it's a bit of a must to access these technologies, but also acknowledge their limitations. They're not there to replace anything. They're there to assist. They're there to make faster responses, faster diagnosis, faster interventions. So, and of course, I see a huge potential in that.
Yeah, I mean, we've seen data that suggests that while AI can outperform the healthcare provider, the healthcare provider combined with AI outperforms out AI alone, right? So it's, if you really want the benefit of the insights from AI, what you want is the experience of the healthcare provider to interpret them and to provide those insights from large amounts of data. So clearly, no one's suggesting that AI is going to replace healthcare providers, but it will make them do their jobs better, or help them do their jobs better, is the goal and the hope, right?
Absolutely, absolutely.
And then, what do you think is sort of the main difference between, I don't know if you can answer this, but you can share this. What's going on in Europe versus what's going on here in the States? What do you see that's different?
I see really a big push in the States towards the equity and also equitable healthcare, and also I think the issue of the cost is more than ever exposed in a way, in a negative way, but also in a positive way that is stirring conversation about payers and patients to have this interaction. I think in the ideal world, you'd be the United States closing the gap to Europe and advancing into a system that empowers the patient to have access to healthcare in a cost-effective way, if you like. In Europe, the system is not perfect, but we have this kind of structure that we have a choice to access a public healthcare. But even within Europe, the healthcare systems are different. Netherlands is different than UK. The UK is different than Germany. Germany offers this kind of blend of occupational health, privatization, and public health. So everything always got their own sides. But one of the things that I'm seeing now, the United States really, and all over the world, we miss the education piece. People need to understand that healthcare is complex, but at the same time is simple. One thing that nobody is doing around the world is to educate people around healthcare. And I remember in UK, for example, a few years ago, I was a sport coach, and there was these campaigns about eating healthier, smoking cessation, all these things going on to try to help people 15, 20 years ago to raise the awareness about the risks of smoking and cancer. And now I know everybody is running out of money. The public systems, they don't have money, but there is nothing. So we want a better healthcare system, but we're not educating people about learning about themselves, learning about their own health to decrease the burden on healthcare systems in the future. So
Isn't that the claim though of most digital health, advocates, that, we're able to bring that information to the patient so that the patient is informed, whether it's through an app or whether or not, they can, register online versus having to go an in-person intake. Are these the promises of digital health to inform folks and let them have a better control over their healthcare journey?
To a certain degree, yes, Mike. In the ideal case scenario, also there's a lot of health, mobile health apps now, from nutrition to diabetes. Is a lot of self-help technology. And you are right. One of the promises of digital health is to actually bringing this data to oneself to manage their own health in their own way. But usually, as I mentioned before, the education piece is missing, and also the facilitation. Who's giving direction? Who is facilitating this conversation? Who is actually encouraging people to engage with their own health? We only care when we are ill. Yeah. When I feel healthy, I'm less likely to kind of engage in any healthy behavior. So it's a bit difficult sometimes. It sounds very simple, but it's a bit difficult to achieve.
And then in the last year, we've seen, the private equity markets go from, just loving digital health and throwing money at it to being a lot more conservative. Funding's dropped considerably. When you're talking to startups, what is the sense around the availability of funding in this market?
I think there's a lot of money still around, but I wouldn't like to play devil's advocate in here. But what I will see as well as a reality check, Mike, is that the market for some reason is shrinking because the big players are involved. The big tech brands, if you look around, all the big tech brands have an interest in health. Okay, Apple, they develop products, but the likes of Microsoft, Oracle, Amazon, all the big tech players have an interest in health, and they will eventually shrink the market for the startups. So maybe in 5-10 years time, the market available for startups, if let's say, if the big players take 50, 60, 70% of the market, will be a 20, 30% market available to the others. So I think the startups, to be honest with you, are a bit up against it going forward.
Yeah, I mean, our sense is one of the challenges with digital health is we've been making a lot of promises for a long time, and we've had great difficulty in delivering on some of those promises. So I think that a lot of the venture funds, they're willing to you said, there's plenty of money. So they're willing to spend money, but they're coming in later, right? Where folks have some market traction, and, becoming less risk averse when it comes to the startup market. To piggyback on your assessment of the big tech companies, I would agree, because we're seeing Google moving into health space, Amazon's taking a big, place. And, I think the benefits of those big players is they have the money and the bandwidth that we need to make serious healthcare changes, because hospitals can't afford it, and they can't, they won't change their infrastructure. It's going to need to come from somewhere outside with lots of deep pockets, which is big tech. I think the good news is that big tech is smart enough to understand that it should acquire rather than build. So I think that there'll be consolidation in the digital markets, the digital health space, but there'll be a lot of opportunities for startups if they can demonstrate they have something interesting, because then they'll be be a prime candidate for any one of those big tech companies that are trying to add to their health tech portfolios. So what are you focused on these days, and what's coming up for you?
Yeah, I'm always looking for new partners to work with. As you mentioned, I have my healthcare channel, Digital Health and Wearable series, where I talk to global leaders around the world around digital health, healthcare, all topics related to the industry. But also, I'm doing working in partnership with interesting companies that have an interest in going to the US market. I'm making inwards to the US market. One of the things, Mike, that I'm aiming to do is to come to the US and also bring some of this expertise from Europe, from the Nordic countries, some of my experience and some of my expertise around these, the things that I've seen that work and the things that I've seen that they don't work. So, yeah, still working with great clients, medium, large organizations that have technology, and also they are always looking to get more exposure. One of the things that I do well, if I may say, is the thought leadership piece, where I interview leaders and I talk to other leaders like yourself about the marketplace. So I'm always looking to start interesting conversations like today.
Great. Well, we appreciate your time today. Again, we'll mention your blog down below so folks can find you. We very much appreciate your time, and we look forward to future conversations.
Thank you, Mike. Thanks for having me. Nice to see you.
Absolutely.